Good afternoon, good evening, good morning to partners, friends, and colleagues here in Washington, D.C., across the United States and around the world that are joining us for the online US-based launch of Dangerous Inequalities, the UNAIDS 2022 World AIDS Day report. It's a special honor today. We have four fantastic panelists that will be featured in the launch of today's report. First is our Deputy Executive Director, Matthew Kavanagh, who's with me here in Washington, D.C. At the UNAIDS office. We have Angeli Achrekar, who is the Principal Deputy Coordinator of the Office of the U.S. Global AIDS Coordinator and Global Health Diplomacy, which leads and oversees Pepfar. We have Harold Phillips, the Director of the White House Office of the National AIDS Policy, and our friend and colleague from Ukraine, Valeria Rachinska, who's the Director of Human Rights, Gender and Community Development at 100% Life, the all-Ukraine network of people living with HIV. My name is Vinay Saldana. I will be your moderator today. I'm the Director of the U.S. Liaison Office for UNAIDS here in Washington, D.C. So we'll try and cover very brief introductory remarks from our four featured panelists, and then that should leave us hopefully about 20 to 30 minutes for short question and answer, any comments. If anyone has any comments over the course of the presentations, please put them in the chat or raise a hand, and we can quickly call on you. And then after the initial round of interventions are done, then we can open up for a Q&A and discussion session for the remaining time that we have. So with no further ado, I would like to pass over to Matthew Kavanagh for introductory remarks and to launch our report for World AIDS Day 2022. Matt, over to you.
Thanks very much, Vinay, and thanks to everyone who is joining and to our guests who are joining us on this day to launch this report. We're here today to launch the report that is called Dangerous Inequalities in advance of the World AIDS Day events on the 1st of December. In this report, UNAIDS is calling the world's attention to a painful reality that we are not currently on track to end AIDS by 2030, as was agreed by governments last year. The reason is inequality. We launched a report in July that was called In Danger, that described the ways in which HIV infections are rising in many parts of the world, falling far too slowly in East and Southern Africa and West and Central Africa, and rising for too many specific populations in the world. And we asked the question in this report, why? What is going on? What explains how and why this is happening? And the answer is, as we see it, because while we've made remarkable progress in many fronts, for people around the world, HIV, for many of them, has become rare and become something that can be lived with. The reality is that for far too many people, the inequalities driving HIV are actually undermining our overall response. So in this report, we highlight three very specific areas of inequality. The first is on gender. As we think about sub-Saharan Africa, both East and Southern Africa and West and Central Africa, what we see is that adolescent girls and young women, this report shows, are 3 times more likely to be infected with HIV than boys and men of the same age. This is a driving factor behind inequality. We do know, however, that if we can enable girls to stay in school and they complete secondary education, this reduces vulnerability by up to 50%. That's why 12 African countries have come together in the Education Plus initiative to support the UN to make it happen. What we want to stress here is that this statistic around unequal HIV infections among young women and among women overall in the region is not inevitable. And one example is that in Malawi, government and donors came together and heavily invested in ensuring adolescent girls and young women in key districts could finish secondary school and receive robust HIV prevention and sexuality education. There was a serious effort to address violence experienced by adolescent girls and young women. And do you know what? It worked. In the Machinga district, supported by Pepfar, the new HIV diagnosis among adolescent girls and young women fell by over 30% in just 2 years. But these are the kinds of programs that address inequality, but that are not been scaled up. The second piece of our report that I want to highlight is focused on key populations. We know that discrimination against marginalized people is hurting the HIV response, and unequal access is hurting as well. In the new UNAIDS report, we show that among gay men and other men who have sex with men in East and Southern Africa and in West and Central Africa, in both regions, while there have been very substantial decreases in HIV infections in the general population, new infections among gay men and other men who have sex with men in the region have not decreased at all in any significant way. This is deeply disturbing. We know that globally, gay men and other men who have sex with men, according to UNAIDS data, are 28 times more likely to be infected with HIV, that people who inject drugs have 35 times the risk, and that sex workers have 30 times the risk, while transgender women have 14 times the risk. These are inequalities that can be tackled, and we know that some of it is driven by policy and some of it is driven by program. To highlight two examples, in South Africa, where same-sex relationships are legal, our data show that gay men are 60% more likely to be living with HIV. This is concerning. We would not like to see any inequalities, but in Uganda, where gay men are criminalized, they're 240% more likely to be living with HIV. In concentrated epidemics like those in Asia, the same plays out. In Thailand, where same-sex relationships are legal, gay men are 11 times more likely to be living with HIV than other men. But in Malaysia, where gay men are criminalized and regularly arrested, they're 72 times more likely. Criminal laws push people away from services. The other piece I would highlight briefly from the report is that services matter. Around the world, generally, key populations have lower access to services, but we know that community-led efforts can actually change that dynamic. And we highlight how in 4 counties in Kenya, including Homa Bay, which has the highest rates of HIV, we've looked and the HIV treatment rates are equivalent or higher among sex workers than they are among all women in the region. That's the kind of response we want, the kind of response that's possible if you focus on inequalities and focus on ensuring that people have access to services. And then finally, I want to call attention to the inequality of children. Today, around the world, 3/4 of adults living with HIV, according to our data, have treatment, are on treatment if they're living with HIV, but only half of children are. Around the world, children make up about 15% of AIDS-related deaths, even though they're only 4% of the total people living with HIV. And then final point from me is to focus a moment on financing. We're here launching this report in Washington, D.C., where core questions of financing the AIDS response are considered. The COVID-19 crisis and the war in Ukraine have increased inequality worldwide. And today we know that there are millions and millions of dollars going into debt repayments from countries in the global south. This is an opportunity for that money to instead go into payments to fight HIV and to ensure access to services around the world. In one study that we recently published, we showed that for every $10 of government revenue in many of the highest HIV burden countries, 4 of those dollars are going to debt repayment, while only 1 is going to health. That has to shift. But meanwhile, we also show in this new report how effective aid programming, and that aid programming is programming like the President's Emergency Plan for AIDS Relief and the Global Fund to fight AIDS, tuberculosis, and malaria. In the new report, we highlight that not only is that funding highly effective, but in fact, when donor funding is increased, funding for domestic resources also increases. Those are countries with high burdens of HIV, like Botswana, like El Salvador, like India, like Indonesia, like Malawi, like Mozambique, like South Africa, and on, who when they have received increased funding from Pepfar and the Global Fund, they have increased domestic financing to be a partner alongside. That is an essential message on this World AIDS Day, that as we think about how to equalize rights, equalize services, equalize access to resources, we know that the best science, the best education can reach people, but that is largely dependent on the financing that's available. Thanks very much, Renee.
Thank you, Matt. And I'd like to immediately turn to Angeli on behalf of Pepfar, and really on the eve of Pepfar's 20th anniversary and continued extremely strong support and leadership coming from all sides of the US government for a bipartisan leadership in the global HIV response. Angeli, please share the perspective on the eve of this important World AIDS Day from the US government and from Pepfar.
Well, thanks so much, Vinay. Thanks, Matt, and thanks to all colleagues that have joined and friends who have joined the launch today. It's really, really an extraordinary opportunity to be together with you on the launch of such an incredibly important report, Dangerous Inequalities. UNAIDS, you are shining the light on these critical issues, these critical inequalities that exist, and really bringing the focus for all of us and our collective attention to these issues so that we can move from words to action. I bring warm greetings from Ambassador Kingasong and the entire Pepfar team, some of whom are on the call today, but also happy to be here with colleagues across the USG. And Harold, it's great that you're on this panel as well. We have one shared mission. We are all of us focused on ending AIDS by 2030. And it's hard to believe that that is just a short 7 years away. Some of us can think of just how quickly 7 years goes by, and the persistent inequalities and inequities that you shared with us, Matthew, and that are featured in this report are the very things that thwart our ability to accomplish this mission. And to end AIDS by 2030, we must galvanize together to end those gender inequalities that drive HIV among adolescent girls and young women. We must end discriminatory laws that prevent access of services for key populations that you described. We must end those disparities between children and adults and treatment access, for example, that we see. But this requires all of us to dig deeper, to push harder, to really approach these issues differently while using data to guide our efforts to tackle these inequalities and inequities that stand in our way of the progress that we are seeking to see. And so in Pepfar, under Ambassador Kingasong's leadership and across the USG, this is precisely what we are striving to do. We're very excited to release Pepfar's new strategy later this week. It's entitled Fulfilling America's Promise to End the HIV/AIDS Pandemic by 2030. And this is co-created by many of you on the line with us today, or the organizations in which you work. But this is really about what we can be doing differently to really boldly move forward to achieve or to close those gaps that exist and sustain the HIV impact and response that we must do around the world. The strategy that we will release later this week on World AIDS Day aligns with the global AIDS strategy and end inequalities and AIDS. It focuses our efforts and our actions on mobilizing political, financial, and programmatic efforts on ending these inequalities and inequities that were described in the reports. It's not just demonstrated by one of the key pillars, which is essential in the strategy of health equity for priority populations, but it is throughout the strategy. It is the way in which we're trying to approach addressing these structural issues, these policy issues, these programmatic challenges that we see when we really look at what is driving some of these inequalities and inequities. And so we're very excited about the changes that are coming, at least from the Pepfar side, as we collaborate with all of you in the implementation. So from today onwards, we have the charge, and we take the charge, and we are excited to move forward together with all of you on mobilizing for action to really make sure that those important words in the report are realized for the people we serve. And so we're in this together. We stand ready and ready to work with urgency with UNAIDS, with Global Fund, with country governments, and with communities at the center to really end these inequalities and inequities that get us to ultimately end AIDS for once and for all by 2030. Thanks very much, Vinay and Matt.
Thank you so much, Angeli, and thank you for your years of outstanding leadership and partnership at Pepfar. I would like to turn immediately to our friend and colleague, Harold Phillips. He's the director of the White House Office of National AIDS Policy, ONAP. And on a week when the White House is particularly busy managing a state visit with the president of France and rooting for the US men's football team at the World Cup, Harold has still found the time to join us for the launch of this amazing report and is showing tremendous leadership and precision and partnership in the outstanding work on domestic HIV policy here in the United States. Harold, thank you for joining us, and over to you.
Thank you, Vinay, and thank you, Matt. And Angeli, it's great to see you as well. I'm very pleased to be here with you all and to represent the Executive Office of the President and the White House for this historic occasion. This year, our World AIDS Day theme in the United States is putting ourselves to the test, achieving equity to end HIV. And it emphasizes the accountability and action and reaffirms the administration's dedication to ending HIV both in the United States and around the globe through an approach that centers on communities disproportionately affected by the pandemic. And this theme also reflects the importance of HIV testing and highlights the administration's commitment to lead with equity in our response to HIV/AIDS and a whole of society approach toward ending the HIV epidemic as we work to augment both public and private partnerships. The report, Dangerous Inequalities, really and truly brings to mind the need and the understanding that some of the systems and the structures that we have created in our societies don't work well for everyone. They are structures and systems that sometimes build walls instead of bridges and connect individuals to the needed and necessary services that they need in order to navigate through life. This UNAIDS report should make us all stop and realize that we must work to end the HIV epidemic for all if we're going to end HIV and not end it for some. Many of us that are involved in program and policy work and research understand the social drivers of health. We also know that for many populations, these social drivers have an impact that is greater because of the many risk factors that they have to deal with. Or you can think about risk factors as coping mechanisms that are used by individuals to navigate through life's challenges that are a result of the inequalities that have created trauma within their lives and their existence. It's things like lack of education, as we talk about, for girls and those opportunities. It's economic opportunities for women and girls and gay men. It's lack of housing. It's access to transportation. It's language access in some of our societies as well that are hampering the ability of key populations to achieve the full and optimal health outcomes that we know are available because of all the work that we've done to get to this point in the HIV epidemic. And I'm so glad that you're releasing this on World AIDS Day, because World AIDS Day is globally this time when we stop and reflect not only on those we've lost and those living with HIV, but the progress that we have made. And this report calls on us to make sure that that progress is equal for everyone, and that we must rededicate ourselves to addressing the inequalities to truly end the HIV epidemic. So I'm really glad that I've had this opportunity to be with you all and to be part of this panel and to kick off our World AIDS Day commemoration. So thank you.
Thank you so much, Harold. Thank you for taking the time to join us today, and please convey our sincere thanks to the president, to the vice president, and to the entire team at the White House for their really consistent and outstanding leadership on HIV domestically and internationally. And so our final panelist is a very dear friend and colleague, Valeria Rachinska, who is one of the strongest, most articulate, and most fearless leaders of civil society and implementing partners working on HIV from Kiev, Ukraine, from 100% Life. Valeria, over to you.
Thank you. Good afternoon, everyone. My name is Valeria Rachinska. I'm from Ukraine, and I'm the Director of Human Rights, Gender and Communities Development for 100% Life, the largest patient organization in Europe, working in 8 countries with 16,000 members and 1 million beneficiaries. And on behalf of the community-led organizations and also a global network of people living with HIV, we welcome UNAIDS 8 Days Report 2022 Dangerous Inequalities, and would like to admit high importance and relevance of this report for the whole world and for the Ukraine especially. The report calls the world's attention to the painful reality that dangerous inequalities are undermining the AIDS response and jeopardizing the health security of everyone. The biggest focus of this report is on stigma, discrimination, and human rights. War is the greatest violation of human rights and leads to the greatest inequality possible. And it's a lot of wars and armed conflicts right now in the world, but I would like to say something about my country, about Ukraine. Ukraine, with a population of over 42 million, have a second biggest epidemic of HIV and tuberculosis in Eastern Europe and Central Asia region. And we are fighting with the both epidemics, stigma and discrimination towards people living with HIV and gay populations. But Ukrainians facing now not only challenges related with 2 epidemics and the consequences of COVID-19, but with the war that started in Ukraine in 2014, in Donbass and Crimea, and transferred in full-scale Russian invasion on the 24th of February 2022. When the Russian invasion took place this past February, Ukrainian people put at risk all our people, but especially those who were already most vulnerable. People living with HIV, people affected by tuberculosis, people in prison, LGBTQI, sex workers, people who use drugs, another key population, women and girls. Thousands of people killed. Millions of internally displaced people are refugees. Hundreds destroyed hospitals. Logistics failed to deliver and distribute. Sitting with the children in a bomb shelter with only 1 month of HIV medication left in the pocket. This was the reality for over 140,000 people living with HIV in Ukraine. But our international partners stood with us. Fortunately, the United States governments and Pepfar, UNAIDS, USAID, CDC, Global Fund were the first to extend their helping hand to Ukrainians living with HIV and other vulnerable groups. For example, in the situation of shock systems, Pepfar procured and delivered together with 100% Life, life-saving medicines for 120,000 people living with HIV. And for that, we are always be grateful to the American government and Pepfar. But first of all, to each and every American taxpayer, because we understand that without American people, no support would be available. The war showed that the best investments of our partners were the investments in civilian sector and community-led organizations that can bravely meet any challenges. We organized the delivery of antiretroviral treatment and other medicines, opened shelters and organized the evacuation of our communities from war zones, continued care and support programs. Our colleagues, partners and friends delivered medicines and food to people. Nothing can stop us from fight for life. I know exactly that we will see this victory of Ukraine together soon. And in the meantime, we will continue fighting where we can do it the best way, helping people living with HIV, those most vulnerable to HIV, to save their health and well-being. And after the war, we'll build a free, democratic state, which can defeat epidemics, stigma, discrimination of gay population, and raise a new generation of leaders who wouldn't be judged by their status. We are grateful to everyone who is helping Ukraine. As I said, the biggest inequality is the war. And we are asking to help in restoration of equality in Ukraine and in the world. We are asking Pepfar support to ensure continuation of antiretroviral treatment in Ukraine for 2023 and for 2024. We are urging Global Fund to support Ukrainian request to increase funding because needs of gay populations and people living with HIV increased significantly because of war. We can do it together. The Ukrainian experience already showed that with this great partnership, we can achieve any targets. It's very hard for me sometimes to talk about it because I'm a woman living with HIV. I passed through 2 wars with my kids, losing my partners due to AIDS and war with the drugs. And I can look at you right now with a pride because I've done my best to support my community, to fight inequality, to win, sometimes without resources, sometimes without mental forces, but I've done my best. And I want you to do the same best for everyone in this world, not only for Ukrainians, because everyone deserved it. But now I am asking for my country too, for the people who are sitting right now in bomb shelters, for people living with HIV that's still criminalized in 21st century in the middle of Europe and criminalized everywhere. The best tool and the most universal tool to ensure equality and restore equality in the world, it's civilian sector. My organization, 100% Life, it's the best example of 20 years of victories in this fight for equality for everyone. And you can repeat it all over the world for all the countries. Just invest in the communities because we are super motivated, we are super involved, and we're always doing our best. Thank you.
Thank you, Valeria. It is such a touching reminder to have you complete the group of illustrious speakers that we have in the launch of our report today, to get this very moving reminder of what does it mean, activism and community leadership in the 21st century. What does it mean to go the extra distance, not only to make a life-saving contribution towards ending AIDS, but also supporting your community, supporting your country at a time that sets a shining example to all of us in the United Nations system and in the international community of the global HIV response. Thank you, Valeria, and to all of your amazing colleagues at 100% Life and across the HIV response in Ukraine. We stand with you. So on that, I would like to open it up for any questions or comments. We have about 15 minutes left. And this is really an amazing opportunity to build on the fantastic presentations that we've had today and the launch of the report. I will put the information about the links to the report so you can download it and share it online in the chat in just a moment. But I'd like to really open this up to any of our colleagues that are online, any of our friends, partners, who would like to ask a question. You don't necessarily have to put it in the chat. You can raise your hand and we will call on you to share your feedback and your thoughts and your reflections with the panelists and with the others that have joined us online. I know on the eve of World AIDS Day, the global HIV community, and particularly the community here in the United States, is usually not at a loss for words. So I'll take that as a sign that we've covered at least the basics of the key messages from the report and highlighted the leadership of the US government from Pepfar and from the White House and from our community partners in Ukraine. But I will check one more time if there are any questions or comments that any of you might have before we close the session. Okay, I'm not seeing any questions or comments. I will put the links below to the report in the chat so you can access them online. And if anyone has any questions today or in coming days in the preparation for World AIDS Day, please don't hesitate to reach out to our team here in Washington, D.C., to our global communications, or any UNAIDS office. And UNAIDS, of course, is not an agency. We're a joint program, and we're really honored to have many of our important partners from the UNAIDS co-sponsors joining us on the call today. So if there are no other questions, I would ask to take a moment to watch the fantastic video we have from the United Nations Secretary General, Antonio Guterres. And upon completion of the video, we will end today's special online event. So if you can cue the video now, please.
The world has promised to end AIDS by 2030. We are off track. To end AIDS, we must end the inequalities that are blocking progress. Today, we risk millions more new infections and millions more deaths. So, in this World AIDS Day, we are calling out in one voice, equalize. The equalize slogan is a call to action, a call to adopt the proven practical actions that will help end AIDS. More availability, quality and suitability of services for HIV treatment, testing and prevention. That means more financial resources. Better laws, policies and practices to tackle the stigma and exclusion faced by people living with HIV, especially marginalized populations. Everyone needs respect and to be welcomed. And better sharing of technology to enable equal access to the best HIV science, especially between the Global South and North. The inequalities that perpetuate the AIDS pandemic can and must be overcome. We can end AIDS if we equalize.
So, dear colleagues, I will then pass to my colleague Matthew for the last word and to thank everyone for today. Matt, over to you.
So thank you to Angeli, to Harold, to Valeria for joining us. What we really want to say kind of concretely as we move into World AIDS Day is that we have made remarkable progress. And in fact, as we launch this in Washington, thank you to those that have come on the Zoom. Thank you to those that are listening online. Thank you to those that will watch in various other ways and mechanisms. The core message here is that we have made remarkable progress and that progress is deeply threatened by a number of different factors. One, real economic instability around the world. Now is a moment to reinvest in the HIV response, to ensure that we've got sufficient resources to do the work that's ahead of us. Because if we do not, then the problem is, two, that we see deep inequalities that are driving the HIV response right now. And those are harder work, not easier work ahead of us in the short term. But the good news is that we are seeing concrete ways that we can actually address those inequalities. That sometimes when we talk about inequalities, it seems big, it seems scary, it seems problematic. But Valeria, thank you for highlighting the remarkable work that's happened in the middle of a war, in the middle of an economic crisis, and in the middle of a personal crisis. We've seen communities rally to the fore and change the response from start to finish. The reality that actually Ukraine has reduced stigma, has radically driven down new infections, and is one of the most equal responses in the world before the war is a testament. And the fact that that response has not been wiped away, but has instead been strengthened in the middle of the war, shows what's possible. So surely we can all be that bold. Surely we can find the resources to ensure that we finish the work that's ahead of us. Surely we can support Valeria, but we can also support the organizations around the world that are really charged with doing this on the front lines. We will be moving into the UNAIDS Program Coordinating Board next month that'll be meeting in Thailand, where we'll be sharing a number of different really important innovations when it comes to community-led monitoring and so our community-led responses. And so please stay with us, but also really take this message into World AIDS Day. We thank especially those legislators that have joined and the legislative staff that have joined that have a lot of the power of the purse over what's going to happen in the near term on HIV. And so with that, thank you all very much, and may your World AIDS Day be powerful, peaceful, and impactful. Thank you all.
Thanks, everyone.